Welcome back to Health Angel Solutions, everyone. We're going to talk about thyroid hair loss today, and I'm going to share with you about 7 tips, maybe a little bit more than that I believe will help you grow back your hair. If you're experiencing thyroid-related hair loss, we're going to go into great detail because I think it's crucial. To do this, let's get out the whiteboard and talk about it. Before we get started, if you're enjoying this kind of content, please subscribe and click the notification bell below, since I would greatly benefit from it. So let's begin here. I believe I have listed the top 7 reasons why thyroid patients have hair loss. Again, this is unique to people with thyroid disorders, but it may be caused by any cause, so this also applies to people with Hashimoto's disease. I don't say causes specifically, but circumstances that cause hair loss that many patients may not be aware of. I just want to start with number 1 because this applies to you if you don't have a thyroid, if you have hypothyroidism, or if radioactive iodine has destroyed your thyroid for any reason. The first, and perhaps most crucial, thing that many of you will have to deal with is your thyroid medication. I know you won't like this because it's a little complicated, but stay with me while we discuss it. There are 3 ways that your medication may be causing your hair loss. And unless you deal with these issues, it will be difficult to deal with the others, so start with this one first, which is why I put it at the top. So, the first way that your medication can cause hair loss is as a side effect of the medication itself. Now, I know what you're thinking, which makes it a little bit difficult to figure out what's going on. But it's not that hard, okay? And here's why. All thyroid medications, and I'm including all of them here, including natural thyroid medications, such as T3-only thyroid medications and levothyroxine synthroid, can cause hair loss regardless of what they're doing in your body. Because if one is causing your hair loss, the likelihood of the others doing the same is very low. So they don't all cause hair loss. I mean, they can all cause hair loss, which is confusing, but even medications in the same class might not cause you to lose your hair. Let me quickly explain. For example, let's say you're taking levothyroxine and you're experiencing hair loss. We can see that you're switching between drugs since your dosage has been adjusted and you believe everything else is going smoothly, but you're still experiencing hair loss. In that case, you wish to move to Synthroid or Tirosint. However, if you're switching from T4 to T4, this also applies to NDT medications, such as Nature and Natural Desiccated Thyroid. If you're taking Armored Thyroid again, your medication is probably optimized. So we have to assume that's the case. If your medication is optimized and you're still experiencing hair loss, it might be time to switch from Armored Thyroid to Nature through ID, or to NEP Thyroid, or whatever you can do within the same class. This will help a lot of you, so keep in mind that the medication itself is what causes hair loss. They go crazy and say, "What's the point? There isn't any treatment." The second way, and this is another big deal, is low dose. So what I'm trying to say here is that you are on the right medication, but your dose is insufficient. So really what you are is hypothyroid still. And this happens all the time. I can't do anything, no, that's not true. It does make it difficult. But simply switching between medications should solve the problem, assuming it's caused by the medication itself. In fact, I would guess that this is probably a small percentage of you overall. But this is a very high percentage of you overall. So there are a lot of you listening to this right now who are simply not optimized regardless of the medication you're taking. And you can't blame the medication, the Synthroid, the levothyroxine, the Armour, or anything else until your dose has been optimized at the right level. Having a low dose simply puts you in the situation of being hypothyroid. And you know that one of the symptoms of hypothyroidism is hair loss, so you can't attribute that to the medication until you're on the right dosage. The third possibility is that your dose is too high. Again, this is a small percentage of you, but you still need to understand it. For example, if you take thyroid medication through Medicare and your dosage is excessively high, you may develop hyperthyroidism, which includes hair loss as one of its symptoms. You can see how this can become a little confusing. Hair loss is one of the signs of hypothyroidism. I realize it sounds a little confusing, But hair loss is one of the signs of hyperthyroidism. And naturally, all drugs can also cause hair loss. But once you know all of these things, you can really begin to figure out what's causing your hair loss. I think that when I help patients, especially those with thyroid issues, figure out what's causing their hair loss, I probably don't know, but maybe 60% of the time it's up here somewhere. So it's either the wrong medication or their dose is too low or too high. Rarely is the dose too high unless you're medicating yourself. Some patients will self-medicate on NDT, and I believe that they tend to go a little too high. Some doctors also do that. In any case, thyroid medication is probably number one in terms of importance as well. Here is iron/ferritin. So we're moving on to number 2, which is iron/ferritin. Now let's quickly review what these things are. If you're on 4 or 5 grains, that's probably a little too much for your body. I mean, there are people who need that, but that's a pretty high dose. The main thing to know about ferritin is that it aids in hair growth in 2 different ways. Ferritin is a measure of the amount of iron in your body. In the first place, ferritin is a nutrient that your body needs independently of your thyroid. Your hair follicles use it to grow hair. So if your ferritin is too low, your hair will not grow. This is a problem for many people, especially those who have thyroid issues. However, ferritin is low in many women because of their menstrual cycle. Keep in mind that if you're losing iron through blood bleeding of any kind, your iron will decrease. And that will be reflected in your ferritin, which will decrease. For this reason, many women who take multivitamins containing iron, particularly pregnant women, will say, "Oh my gosh, my hair is growing like crazy. This must be this multivitamin." This prenatal isn't the prenatal, rather, it's the iron in you. You were simply low, and you probably didn't realize it, which is why ferritin is so important. According to statistics, almost 50% of thyroid patients have low ferritin or low iron, and the reason for that is the way your thyroid interacts with iron and influences iron absorption. If you have a hypothyroid state, especially if your dose is low, as I mentioned earlier, your body will eliminate a lot of the iron instead of reabsorbing it, which will cause your ferritin levels to drop. This will result in hair loss, which could cause parrot ends, and ferritin itself is necessary for your thyroid to function, because it affects not only your hair, which is important aesthetically to many of you, but also your thyroid function, which is very important. You need ferritin and iron to function properly at the cellular level. This is the level I want you to aim for. By the way, I've already discussed these tests, and I have another video that discusses all of the lab tests that thyroid patients should be getting. Of course, I included this in this video because it affects your thyroid function significantly. What you want to look for, though, is the range for iron, which is typically between 10 and 150. It's a wide range, and many of you listening to this will be under 30. Okay, so you'll fit in somewhere in this range, so technically you might be normal. But I've seen a lot of people who are not in the 10 to 11 range, so that's like the very bottom of the ranges you could be. Numerous studies have shown that you need at least a ferritin level of 30, but ideally a ferritin level of 50 to 70 nanograms per milliliter. Just check your labs. For that hair to regrow, 50 to 70 nanograms per milliliter are needed. So that's the ideal range you should be searching for. Don't just look at this reference range, which is 10 to it. Sometimes it's less than 50. For example, it could be 9 to 149 or something. You want it to be within this range, so it's crucial to check that out. Number 3. This one is related to excessive use of certain supplements. The 2 that I'm highlighting here are selenium and biotin. Yes, low levels of these nutrients can cause hair loss, but most of you already know that they can be used to grow your hair back. What I see more often than not, though, is that high levels of these nutrients can cause hair loss. Let me explain. Imagine that you're reading this and that you've read somewhere that selenium and biotin are important for hair growth. I've included this because it's a kind of slick point that many people miss, and you may be thinking, well, I'll try that. You may have read somewhere that you're taking a relatively high dose. So you've been taking that dose for 6 months or more, or perhaps even 3 months is enough in this case. However, the point is that using these specific nutrients in high levels can actually contribute to hair loss. So even though you may be using them because your hair is falling out, using them in an excessively high dose can also cause hair loss. I've adjusted my medication and my iron is good, but you're still taking 400 micrograms of selenium a day, which may be too much and contribute to the fact that your hair isn't growing back. Keep in mind that this is why I usually advise moderate dosages of both selenium and biotin, particularly for thyroid patients, as these factors can cause hair loss when taken in excess. Number 4 would be low zinc and B12, which are slightly different. But since I discussed nutrients, numbers 2, 3, and 4 are all related to nutrients, right? We're discussing iron ferritin, selenium biotin, zinc, and B12. I would say that most people are deficient in these nutrients, so you don't need to worry about that. However, if you're reading this and you've been taking zinc or B12 for a long time, it's probably not causing your hair loss. However, if you're reading this for the first time and you're thinking, zinc, I've never heard of that or B12, then you should be concerned. I don't know, you might be using the wrong kind of beets. If you want more information on the symptoms of a B12 deficiency, watch my other video. However, you might be wondering, I don't know if my B12 or zinc is optimized. In that case, it might be worthwhile to take either of these supplements because even at higher dosages, taking them won't cause hair loss. However, they might promote hair growth. I see that many people watching this will be deficient, especially thyroid patients, so low zinc, low B12. Number 5, we're on to testosterone androgens. Male pattern baldness is a condition where a woman's hairline starts to recede, and she may develop thicker, darker hairs on her face and other parts of her body, which is something that women shouldn't have. Many women listening to this, especially those with thyroid issues, will have disrupted testosterone in some way or androgens in some way. Now, what I want you to focus on is androgens that are too high, which you can usually find on your lab tests by checking a free testosterone or a DIA. Therefore, you need to monitor your testosterone and androgen levels. If you check these levels and they are high, you can take certain supplements, one of which is zinc, to help lower your androgen levels and help remove the hair loss that may be causing and affecting your thyroid. Additionally, your thyroid does affect your testosterone, which is why this is so important. If you have hair loss from any cause, but particularly if you have thyroid issues, you'll find that your thyroid does affect your testosterone, which is why it's too low. However, if you are on the PCOS spectrum, your testosterone and androgen levels may be too high, so pay attention to those again. I mentioned checking ferritin and testosterone, which are part of my standard additional lab tests that all thyroid patients should get. I have a video on it, and this is why it really just explains what's happening in your body. Okay, number 6 was number 5. We're on number 6, the E2/P, which stands for estradiol or estrogen-progesterone balance. So yes, you can still see that good. And so, once more, this is because your thyroid affects your testosterone, which results in hair loss. Your thyroid affects the balance of your estrogen and progesterone, which can also lead to hair loss. By the way, this is also the reason why women often experience hair loss when they enter menopause. It's due to the decrease in estrogen, but estrogen is equal in that both high and low levels can cause women to lose hair. So you should monitor your estrogen to progesterone ratio. If it's low, many of you will find that your progesterone is extremely low, and most likely your estrogen is high. That describes a condition known as estrogen dominance, and in that situation, you'll most likely need to take steps to try to raise your progesterone levels once more. Check the balance between estrogen and progesterone. That's a topic for another film. Finally, autoimmune. Well, as I mentioned earlier, a lot of people with hypothyroidism have thyroid problems that are brought on by an autoimmune disease called Hashimoto's thyroiditis. I know that most of you are aware of this, But for those who aren't, just know that 80 to 90% of people with thyroid conditions have this autoimmune disease. Now, if you have one autoimmune disease, it's much more likely that you'll get another one. All right, so one of the autoimmune diseases that causes or contributes to hair loss is called alopecia. This condition is characterized by your body attacking the hair follicles, which results in hair loss. You'll discover that many people with Hashimoto's also have alopecia, so everything that's happening up here is irrelevant because if your hair loss is caused by alopecia, an autoimmune condition, your problem is not any of this stuff. Rather, it's your immune system. So, you need to keep in mind that there are a lot of other things you can do to help someone with thyroid hair loss, and that optimizing your vitamin D, taking things like zinc that could also help, and reducing inflammatory foods, and so on will help reduce immune function, which can then help you treat your alopecia, which will help you with your hair loss. Finally, we can talk about genetics, which is number 7. I don't like to because genetics is kind of the last thing that comes to mind when I'm trying to help someone with thyroid hair loss because there are so many other things that you can do. If you're experiencing hair loss, please leave a comment below and tell me about it just saying I am or yes or hair loss or something like that. That way, I'll know how many people I'm talking to and how many problems they have. If you've been able to fix your hair loss, please share what works for you because you'll discover that this is sort of a systematic approach.